For whatever reason, the CDC's communications about COVID during 2020 and 2021 was, at best, confusing. The reality is that when guidelines changed without adequate explanations, consumers were confused, then suspicious, then angry. I think many of us were caught by surprise that public health and medical care became partisan issues, with truth squads constantly pumping false information out to deny, attack, and stigmatize even facts that were fully supported by legitimate research. They proved that repeating and amplifying misinformation is an effective way to convince people that something is true, even if it isn't. Healthcare communicators have to watch this and learn how to compete better. Learn how to compete better. That is where Kathleen Larry Luton nails it in the Communications Golden Hour book. If you want your information to win, it's now a competition, a battle over who can do it better. I'm your host, Tim Conrad. Welcome to the Wildfires, Floods, and Chaos Communications podcast with the third and final episode with my guest, author Doug Levy. So we're in an era of misinformation and mistrust. How do we communicate with people that don't trust what we are saying?
Step number one is to recognize that people don't trust us. And for those of us that have spent our whole careers attempting to communicate truthful information to help people live healthier, better lives and stay safe, that's pretty disturbing. But that's the reality. Just because we don't like it doesn't mean we get to change it. Mm-hmm. So understanding that we're in an era of mistrust is step one. Then we also need to look at how are people getting their information? Who do they trust? One of the things that was a bit of a shock to me when I fully accepted it was the realization that when people are afraid, doesn't matter how smart they are, facts don't matter. I had to communicate about the Ebola outbreak. Gosh, was that 10 years ago? Wow. And we had an Ebola case at the medical center I worked at. And one of the things that I was not fully prepared for was the most extreme challenging communications activities that I had during that period were with people who were trained scientists. One of them, it didn't matter what scientific literature I gave her to show that there was literally zero risk to her or her children, given where they were and where the case was. I mean, they literally were miles apart. 30 years of science on how Ebola is transmitted meant nothing to this PhD scientist because she was afraid. And I just thought, give her more science, more science, more science. No, that only made it worse. I put together a worksheet for some clinicians a couple months ago where we were really looking at some of the ways to deal with messaging in an era of mistrust. And I mean, these principles were developed for health communications, but they really work across the board. Thing number one is you've really got to understand who your audience is and what's their environment, what's their point of view, where do they get their information, who do they trust? What are their immediate concerns? In many cases, we go out to communicate about something thinking the most important thing is the long-term recovery. When the folks on the ground might just want to know where do they get their milk and bread while the store is closed.
Yeah.
Practical stuff. You need to know what's on the mind of the people you're trying to communicate with. You also have to be crystal clear about why you are communicating and what is your main point. And you've got to reduce it to a single message. We used to come up with like 2 or 3 different key messages. No. One point, crystal clear. You need to make sure that it's bulletproof so that you've got to have facts to back it up, but you're not going to necessarily spew those facts as part of your messaging because the facts don't matter. Sprinkle the data in sometimes because it might help, but don't be too precise. So it's like, I feel comfortable using the vaccines because out of thousands of people who have used them, there have only been 3 adverse side effects, and they were treatable, minor, far less consequential than the disease we're trying to prevent.
Mm-hmm.
And make sure that you are reflecting and respecting the audience's point of view. So feedback to the audience, something you've heard from them. Like, I know that you're concerned about how many streets we have closed. We're working as quickly as possible to get traffic moving again, but we're only going to do that when we are certain that it is safe. And we appreciate your patience.
Yeah. And that's I use kind of that technique. I listen to the people and build my strategy from the people up. And one of the things I do a lot is I mirror what they're saying. And it's especially great when you're having those one-on-one conversations or with a small group of people.
As long as you don't repeat a phrase or a word that connotes something that is inaccurate.
Yep.
Because when you do that, you make it possible for your comment to be taken out of context.
That's right. Yeah. So, yeah, and it's taking something that somebody says to you and reiterating back and then giving them some information that will help them to wrap their head around what the problem is and what the potential solution may be. So it's an art in those moments, especially in emergencies, in crisis, in disaster. It's an art, and you have to be very cautious of how you do it. And one of the things that has shifted, I found quite a bit, is when I first started this 20 something years ago, you could have a conversation with someone, and the next day you might see that same person may be very different with you because their mental health is very different. And what's different today is they're shifting right in front of me within 10 minutes. And they're going through a lot of different things. And so the stress and the pressure is greater today, and it's affecting people much different. So you have to be very cautious of that moment to moment. So if you do, try it. But certainly find people that are around you that are really good at that, and learn from them. So
everybody's job has gotten harder, and that's true on both sides of the equation, in the audiences and among the responders, which is also why simplicity is critical. I mean, again, go back 5 or 10 years and we'd put together a briefing sheet that might have a ton of data because we thought people wanted it. And we think it's useful, but if people are alarmed, nervous, and not trusting you, don't give them too much to work with.
Yeah.
This is why, that single message is super important. And don't overdo the facts, because citing the scientific studies is not going to get you very far, even with scientists, as I learned firsthand with multiple. I mean, that was the most egregious example, but I've had similar things happen with others. And really choose your messaging carefully. The other thing, too, is it's very important to really understand how the folks on the other side of your communication are going to get your message. I've seen some, unfortunately, colossal failures where government agencies are wonderful about formatting, and they might have a mandatory, preface to every message that has, some kind of gobbledygook, and the get out now part is cut off when people see the message on their phones. That's not helpful. So you really need to understand the whole system. And we've also seen some other just colossal failures where people responding to emergencies have not understood how their different tools work. And if the utility poles have all burned down, you probably don't want to be using landlines to get emergency messages out.
Yeah, it's something that I've experienced before where a community that was flooded and had no power, and they were trying to send electronic messages to them. Did you know that monarch butterflies can fly up to 160 kilometers or 100 miles in only one day? How do you measure if someone has experience in their field, kind of like a butterfly? Have they sent evacuations by road, boat, flight, canoe, and trail? Well, I didn't send the one by canoe, but I worked with the person who did. Do they need a team with experience with hurricanes, murders, sports, landslides, airlines, financial crisis, pandemics, wildfires, fisheries, floods, destination marketing, ice jams, dental, healthcare, or industrial incidents? We've got all those covered among our associate team, and most of them many times over. We can help you with public relations, public engagement, or marketing you may need, including training. We work with many organizations, including First Nations, governments, nonprofits, and business. We excel at the toughest work, which has drawn us to disasters, emergencies, crises, and issues. Yet we love to work on happier projects. So if you've got some of those, we're in on them too. We've organized large multi-day events, led community outreach and public education programs, facilitated public participation in dignitary sessions. You name it, we've kind of done it. Learn more about us at butterflyeffectcommunications.ca, where you can join our newsletter list. Now, fly back to the Wildfires, Floods, and Chaos Communications podcast. Just to go back to my earlier comment about mirroring, you had said in your comment just now of how to, people are going to say it back to you. And that's the other, it's another mirror. And that's when it's the other thing that I've noticed is people are getting it then, but then they may process it differently later, and they'll come back and see me another day and they've got a different perspective on that. So it's something to keep in mind that is happening out there, and it's a shift that we've seen. So
clinicians, when they're seeing a patient and conveying difficult information, will often provide the information and then ask their patient to tell them what they just heard. It's like, yeah, I want to make sure that I explained this clearly. Mm-hmm. Can you just tell me what you understood from what we just discussed? You can't do that with a large audience, obviously, but that is a tactic when you're having a one-on-one conversation on something important and detailed, and you've got a receptive participant.
Yeah. And ultimately, if the stress level is high, the amount of information they can take in is very low.
Absolutely.
So how can organizations improve their trust?
Step one would be understand why the trust is missing. Sometimes it's because of something your organization did. In many instances, it's because of something that some other organization did or somebody else outside of your area. This is particularly visible in police departments. The actions of a police officer in Minneapolis caused protests and outrage literally from coast to coast. Mm-hmm. Even though there's 18,000 different police departments, each one with its own sets of rules and so on. But, because of that uniform, everybody is seen as part of the same. Yep. It's the same thing that a Starbucks barista who gets caught on video doing something really good or really bad impacts every Starbucks across the world. So really understand how you got into the deficit. And that includes understanding just the societal attitudes. Anybody who works for the government is seen as potentially untrustworthy these days. That's just the reality. Among a significant portion of the population, at least in the United States, scientists are rejected automatically. Mm-hmm. Yeah. I mean, it's kind of ridiculous to me that instead of listening to somebody who's been studying something for 40 years, we're going to listen to somebody who just made something up on the internet. However,
that's where we're at.
So we can't just ignore that reality. And we have to meet people where they are. And that's going to take some learning because many of us are not living on TikTok or Twitch or Telegram. Yep. We don't communicate in 15-second videos, but we have to.
Several courses are being developed, and I'm happy to let you know that the first course will be on CanadianTraining.ca really soon. Job interviews, public speaking, messaging, and speaking to media. How to speak more confidently to groups of people in many settings will be our first course. It will teach you skills useful for many settings which require you to speak. where your nerves may be winning the battle right now. Launching soon. Sign up for updates and early access at www.canadiantraining.ca to learn how to speak more confidently to groups of people. Subscribers will also get free checklists, guides, and more. Canadiantraining.ca. Learn from our mistakes. Someone should. The traditional media landscape is dramatically shifting and disintegrating, particularly here in North America. We've seen it here in Canada for about 20 years now. It's just been just constant layoffs and shutting down of news agencies. A lot of communities are starting to lose their local newspaper, so the long form news is no longer there. So even just getting the word out about community events is getting difficult. And yeah, it's starting to have a really significant impact here in Canada and in our small communities, especially because we are very spread out in Canada, and we have a lot of really small communities across this country. So I am curious to see what you've observed in the United States.
Like most things, there's good and bad. We are in an era where everybody's a journalist. Journalism as a profession is no longer attracting people who want to make money because there's not nearly, salaries in journalism have come way down. They were never high, but they've come way down. Employment for journalists has dropped dramatically.
Yeah.
Yet the number of journalists is up.
Yeah.
Many of those people are individuals, in some cases, folks who left full-time journalism jobs and are launching their own publications or just doing it as a side job out of community commitment. Some of the biggest stories of the last couple of years have been broken by these individual bloggers, basically. And in fact, I can think of a couple of the top political journalists in the United States now are folks who have left major newspapers or formerly major newspapers to set up their own publication. And it's actually not a bad model. Some of those people are even making some money, or at least getting by. So we've got a dispersion of media that also matches the dispersion of population. So it's harder for folks like us because, when I was growing up, I think 2/3 of the United States adult population watched the same evening newscast.
Yeah.
There were 3 networks. I think we had 7 channels on TV. And, if you wanted to make sure the world knew about something, you needed to get it in front of Walter Cronkite. We've come a way long way from that. And I was looking at some data this morning that shows it's come even farther than I had realized. The major cable TV networks, their audience has dropped significantly. And the age of their viewers is really high. And this isn't just one channel. All the major cable news channels have old audiences. That's a problem if you're trying to reach most people. So, and since 2020, it's just accelerated.
Yeah.
A lot more people are getting information from TikTok. I don't entirely understand how their algorithm works, but because they're so short, people consume a lot in a very short amount of time. And podcasts also have very much become the mainstream now. Yeah. More people are listening to podcasts than terrestrial radio, and it's no longer the secondary market. So if we're trying to get messages out to the broader public, we not only need to understand that there is this bigger universe of journalism, but we have to really understand our audience and dig into them and find out which podcast, which influencers, who do they get their information from? And the good part is that in many communities, you have one or more local social media people who really do have a good audience. And most of these people are pretty civic-minded. Get to know them, and they probably want to help you get information out to their audience.
Yeah, that's so true. Yeah, absolutely. And it's, you made a good point on just the impact of how things have shifted. So here I am in my community. I'm here in Kamloops, British Columbia. And our news talk radio station just shut down and went to a different format over these last couple of months. Yet there are new podcasts popping up every day in and around this region for different topics and so on. So it's not that people aren't listening; it's that they're listening somewhere else and listening to a different format. And it's a very dramatic shift that we've seen, and I'm sure we're going to see more of it. But I also too, we're going to see where TikTok ends up landing over these next bunch of months. It may not be a tool that's out there for people, so that will again shift things to something else. We're not sure what, but the TikTok format is quite an interesting format. I learn a lot on there, and particularly love the high-speed button that they have that you can get people to talk much faster and go through. And it's been I've really quite enjoyed how that platform can get information out to different audiences. So there's it's a shift. In some cases, it's a good shift. There's some bad things about TikTok, obviously, which is why it might disappear. I'm curious to see what ends up happening next.
And there's a federal law and some state laws that prohibit certain U.S. government people from using TikTok. However, if a lot of people in our communities are getting information from TikTok, how do you ignore it? How do you not? I mean, I guess I can understand why people might not want government folks to be using TikTok, but you have to be aware of it, and you need to be aware of what's being communicated on there, because that's how information and misinformation, including disinformation, is spreading.
When I started this podcast, this is one part that just really surprised me. An audience from so many cities, towns, and villages all around this beautiful marble we call home. Hello to our listeners in Singapore, and to listeners in these communities: Manila, Philippines; Astoria, Oregon; Longueuil, Quebec; Jeddah, Saudi Arabia; and Barcelona, Spain. Thank you for listening to our podcast. You join a global audience with listeners in over 30 countries and 300 cities. Wherever you listen, whether it's Spotify, iTunes, or Amazon Music, please subscribe, leave a review, and boy, it helps when you share with a friend by sending them communicationspodcast.com, where you can also sign up for our newsletter. All right, we're up to the end of the podcast here, and I have 3 quick questions for you. Are you ready, Doug?
Fire away.
What is one book, documentary, or resource that you recommend for those learning about crisis and emergency management?
Well, that's an easy one. I'm going to say my book. I put everything I know into it, so I do recommend the Communications Golden Hour. It is a pretty good overview of what to do ahead of time so that you know what to do when the alarm bells go off.
Yeah, absolutely. And you've got 2 books. Let's just make sure the audience knows. If you're watching on screen, you'll be able to see this one. This is the newest version, the Communications Golden Hour book, which you can pick up on Amazon and lots of other places. And then there's the smaller version from 2018, also with the same name, but the first edition. And I really recommend picking up both of them because they are different books. As you mentioned earlier in the interview, the smaller one is really good as a hands-on guide when you're in the thick of it. And that is why mine is got curled pages and has been beat to pieces. It's been through war with me. So great resources, and can't recommend these 2 enough. So
thank you.
And if you happen to follow our newsletter, every once in a while I throw in a code for those people in Canada that they can get a lower price on the book delivered right to their door. So. All right. What advice could you give information officers or communicators managing crisis or emergencies that would help them do their job better?
Know your audiences, and that's a continuous job. The more that you are out and about, understanding what's changing and who's moved in, who's moved out, who are people paying attention to, what are the kitchen table concerns in your community, because anything you're communicating has to fit within the context of the audience. And in so many instances, your audience's situation is different from yours.
Mm-hmm. Yeah, absolutely. How do you maintain your mental well-being during the most intense response moments?
One of the best skills that I've ever been taught is box breathing, which is, it's a simple meditation practice. You don't have to call it meditation, but this is something taught in the military, in fire departments, and many other places. And it's just a simple step. You breathe into a count of 4, hold it for a count of 4, breathe out for a count of 4. Do that a couple of times, get yourself grounded, and then continue. And if you do that when things are rough, you stay grounded. It's so important. And it's during those moments of pause that you realize, oh, I need to make sure that my team gets a break. Or what about all the people that live in the senior center across town that we haven't been in touch with yet?
Mm-hmm. Yep. Great piece of advice. Well, thank you very much, Doug, for joining me for an episode of Wildfires, Floods, and Chaos Communications podcast. I've certainly always appreciated our conversations, especially when we can record and share them. So this is a treat for me to do this on my side of things. Doug, the work that you have put into creating all versions of the Communications Golden Hour book is important. It's critical in moving the many forward in the work that we do in our roles today and in the future. So I really want to thank you for all of the work that you've done on these great books. And thanks very much for joining me today.
It's been my pleasure. You've been a model for how to do big emergency communications, and I've had the honor of learning from you as well. So happy to be part of this.
Yeah, I really appreciate that, Doug. Thanks a lot. So for those listening, jump over to www.communicationspodcast.com, give us a review, feedback, or guest ideas, and of course, share with a friend. And that wraps up a 3-part series with Doug Levy. So thank you very much for listening and taking the time to learn from our guests. Do you have suggestions for a guest or topic, or maybe some thoughts about one of our episodes? You can write to us at communicationspodcast.com, where you can also leave a review. Wherever you listen, whether it's Spotify, iTunes, or Amazon Music, please subscribe and share with a colleague or friend, such as someone in municipal government. Remember, we also have that newsletter, and we put up more information, transcripts, links, and information about our guests on our website at communicationspodcast.com. If you like this episode, check out Season 2, Episode 10, Avoiding Panic with Dorrit Mason. Thank you for joining the Wildfires, Floods, and Chaos Communications podcast, a production of Butterfly Effect Communications. We are masters of doom and gloom communications, bringing calm to chaos. Goodbye. Hear me later.